Hi, welcome to everyone to our first video chat of the month of September. We're going to be running a series of these throughout the month with people who run PF support groups, with patients, and with people who work in the healthcare industry. I'm delighted to be joined today by Michele Peters, who runs a support group in Illinois. She runs fundraisers for PF and also raises awareness. So welcome, Michele.
Thank you very much for having me.
So maybe just to start, maybe for those that don't know you, if you could share your personal reasons, why you're so heavily involved in PF.
Okay, my husband Jeffrey was diagnosed with IPF in March of 2010. I think like most people, we had never even heard those words before. We had no idea what it meant, what it was all about. I think like a lot of people, we were relieved to hear that it wasn't cancer, thinking that that would be the worst thing. And I do think that this is far worse. We became involved, I would say, shortly after his diagnosis. We did walks, we started small fundraisers, and we formed our very loose organization called Team Jeffery for PF. After a few years, we actually ramped things up and we became our own 501c3 with that. Jeffrey lost his battle with IPF in May of 2015. We took every single step of this journey together. Doctor's appointments, just learning more about it, trying to figure out, gather information, which was difficult at best. I think even still some of the information you find isn't real hopeful. Unfortunately, he was into a clinical trial when the 2 medications came out, and he had to finish that up before he could even start on one of the 2 medications. So he came into that very late. I continue to run the support group that he actually took over in August of 2014. I've been doing it for a little over 3 years now. It's extremely rewarding. It helps me to help other people, which is ultimately what we always wanted to do. We try to provide a lot of information and education and just camaraderie. There's nothing like being in a room full of people who understand exactly what you're going through when really not even your close family members understand it.
What are the types of things that people who first join the support group, what are the types of things they're looking to know or they need to know, and how does that evolve over time?
I can tell you one quick story about a person who came in. Her boyfriend had been diagnosed and he didn't come to the meetings at first. Her very first meeting, she really didn't make any eye contact with anybody. She listened and she took a lot of notes. She really didn't ask any questions, and she cried a lot. He just had his double lung transplant actually about 3 weeks ago.
Oh, wow.
And she has the change in her is amazing. She counsels other patients now. She's very outgoing. Her amount of education that she's gotten is incredible. So just from that one person, who you could see this metamorphosis in her by coming to the support group and becoming an empowered caregiver. It's amazing. But the questions that are asked, I mean, they really run the gamut. People want to know about oxygen. They really want to know about your personal journey. I had 2 patients, their caregivers actually came up to me the very first time I met them and asked me, what's it like at the end? Which basically just sort of sucked the air out of me. It's a very personal question, but it just points to how much people really want to know, to become educated so that they can be their own best patient advocate. But they want to know about oxygen. Whose doctor do they see? What are the good doctors? What are the better doctors? They want to know about the medications, the side effects. Just it really runs the gamut. And then because they're with other patients, they can give them tips about how to live better with it every day.
You mentioned there an empowered caregiver. It's a phrase you don't hear too much, but actually is very appropriate. You hear about empowered patients. Tell me about what a caregiver needs to be empowered?
I think a caregiver needs just as much information as a patient. Again, if you're lucky enough to have a caregiver, I feel very compassionate for people who don't have anyone to help them on this. But it's like I said, Jeffrey and I took this journey together every step of the way, and we just learned all that we could. And I think that you as a caregiver need to know that. My job sort of was to keep notes. I think it's really important to, we would keep like a journal in a way. And if something came up during our appointments, we were like, oh, that's really something we need to ask, I'd be sure to write it down. So I was the one who was taking in the information while he was sort of listening. And it's good to have two different perspectives, because sometimes, you get to talking about it, it's like, well, wait a minute, that's not what I heard at all. But ideally, as I've watched other patients now in the support group, I think 3 people would be the best thing to do. You'd have that third person who's going to be the note taker, so that the caregiver is not distracted from, what's being said. Sometimes as you're writing something down, you may be missing a little bit of that next answer to your question. So I think that it's a partnership between the caregiver and the patient.
Tell me, I know you do a lot of events, and I know you've got one during the month of September. So tell me about that and any other things you're doing during the month of September for raising PF awareness.
Our trivia night event has sort of become Team Jeffery for PF signature event. This will be our 3rd memorial one. I believe it's our 5th one overall. It's obviously it's a trivia contest. We have great prizes for the winners. And then there's a lot of silent auction items, a lot of raffle items. We've had wine grabs. This year, I think we're going to try a 50-50. And we raise funds to help the PF community as a whole. Our impact wants to be on a personal, local kind of level. So this year was our first year that we've awarded 2 scholarships to 2 students whose patients or whose families have been impacted by PF. That was an extremely rewarding endeavor. And we do some smaller ones during the year. We've done a paint night where that painting happened to be a painting that said "Just Breathe," which I thought was very significant, and we did it on Rare Disease Day. We've done restaurant weeks where we'll pick several different restaurants that people can go to, and a portion of the proceeds come back to Team Jeffery for PF. So we've really kind of stepped things up in the last few years, and it feels really good to be able to know that what we're doing not only honors Jeffrey, but is really impactful for patients and caregivers.
I know a lot of people often ask, oh, what happens after the month of September? Because September obviously is very important for raising awareness, but you're doing things all year round and running support group all year round.
We try to keep it going all year round.
And I'm assuming the trivia night is some good fun as well. What sort of questions are you the quiz master?
No, I'm not the quiz master. My friend and vice president of Team Jeffery for PF, Meg, she's the quiz master, and she scours, comes up with categories, and she'll throw in an easy one once in a while, but there's always a consensus among the team to come up with the right answers. Some of them are pretty difficult, and of course we say no cell phones. Absolutely, you can't cheat. It's for charity. So
absolutely. Well, listen, thank you very much for your time today, Michele. Looking forward to seeing what happens with your quiz night on later on in September. And best of luck to you and to everyone in your support group.
Thank you, and thank you so much for this opportunity. I really do appreciate it. It's very, very important, passionate work for me. Thank you.
You're doing great work, so thank you very much.
Thanks. Bye-bye.
Thanks, Bye-bye.